Good afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along with us. Also happy to be joined this afternoon by London Mayor Ed Holder, the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackie, and the Executive Vice President, Interim Chief Clinical Officer, and Chief Nursing Executive at London Health Sciences Centre, Carol Young-Ritchie. We're also glad to have the media in attendance with us this afternoon, and if you do have a question, if you could just click on the text bubble with the question mark here on Microsoft Teams, indicating your name as well as your media outlet and who your question is for. And a quick note on the questions that we'll be taking today. In light of recent events happening yesterday in Hyde Park, the Hyde Park Road area of London, there will be more details about that at a news conference within about an hour. We will be keeping the questions on this media briefing to matters related to COVID-19. So I'd just like to mention that right off the top to get that taken care of right away. Welcome this afternoon also to those who are tuning in on Rogers Television as well as the Rogers Facebook page and YouTube channel, listeners on Global News Radio 980 CFPL, and those who are listening on the CTV London website. Let's get to our opening remarks, and we'll start with Mayor Ed Holder.
Well, thanks, Dan, and good afternoon, everyone. On behalf of London City Council and behalf of all Londoners, excuse me, my heart breaks for the families of the 4 individuals who were tragically killed last night in Hyde Park. Words can never express how we feel at this time. I know all London shares in that grief. Now, more information will be released by the London Police Service during a news conference scheduled for 3 o'clock this afternoon, and I will have more to say at that time as well. But for now, I just want to stress my profound grief and condolences. This is a tragedy of the worst magnitude. I'd also like to thank members of the London Police Service, the London Fire Department, and Middlesex-London EMS for your compassion and professionalism in responding to this traumatic event. You make us proud on a daily basis. And in this, our darkest hours, last night is just the latest example. So out of respect for the victims of last night's tragedy, I would like to defer to Dr. Mackie for all COVID-related updates this afternoon. But briefly, however, I would like to reiterate my thanks to Ministers Urick and McNaughton for their work in helping the Health Unit and Dr. Mackie and me close the gap on London's vaccine deficit. Last week, shortly after I reiterated our position to Health Minister Christiana Elliott, I received word from Minister Jeff Urick that London Middlesex would be receiving 3,000 additional doses this week, over and above our usual allotment. That's in addition to the 2,000 extra doses received last week. There's still work to do on this front, and our conversations with the province are ongoing. But I take those 5,000 doses secured in less than 1 week as an extreme show of good faith and a strong sign that the Premier recognizes the need to shore up our supply. So over to you now, Dr. Mackie.
Thank you very much, Mr. Mayor. Thank you also for your reflections on the tragedy yesterday. Fortunately, on the good news front, COVID has really come down across the region. Just 3 cases yesterday. That's the lowest we've had since November 16th. That's more than 6 months ago. We of course know that Monday numbers are often low because the weekend see lower testing volumes, but there's no way we would be close to even this number if we were still seeing our 3rd wave raging. So huge thanks to everyone. I know there have been sacrifices across our communities by individuals, families, students and businesses. And of course, to everyone who has come out to roll up their sleeve. The vaccine campaign is a big part of this. And you, as the people who've chosen to get the vaccination, to protect yourself, protect your family, protect the people around you, are making a big difference. I think I'll pause there, Dan. I know we'll have lots of questions, but I'm also going to pass now to Carol Young-Ritchie from London Health Science Centre.
Great, thank you. Good afternoon, everyone. Thank you for this opportunity to join today's briefing to provide an update on COVID-19 the COVID-19 situation at London Health Sciences Centre. As of this morning, we're caring for 22 COVID-19 inpatients, 9 of which are in critical care. Of the 22 COVID-19 patients, a number of patients we are caring for from outside the region are fewer than 5 in critical care and fewer than 5 in acute care, which is great. We are seeing the case counts continuing to trend down within our hospital and across the province, where the lowest number of new cases presenting in nearly 6 months has been reported. It's no doubt been a long road, one that we're still on, and we are optimistic that if we continue to stay the course, the third wave will soon come to an end. While we continue to care for COVID-19 patients and those who have recovered from COVID-19 but remain in hospital, we're starting to turn our primary focus towards recovery efforts. We've begun the gradual process to return staff who have been redeployed to support the increased COVID demands in critical care and medicine back to their home units, and been able to slowly increase our surgical bed capacity as a result. We're striving to ensure that we balance looking after our people effectively and responding to COVID and ramping up some of our scheduled activity. I'm pleased to also share, over the course of the last week, we have introduced changes to our visitor policy, which allow increased designated care partner presence in the hospital for both pediatrics and adult patients. We are happy to have been able to safely take this first step to increase our visiting policy and know how difficult it is for patients and families who've had stricter limitations in place. As we go forward, we will remain committed to actively reviewing our policy to determine when we can safely further expand access for additional care partners to come into the hospital. I want to take this opportunity to thank the community for all your support over the prolonged third wave. Without your ongoing efforts to adhere to provincial orders, follow public health guidelines, and getting vaccinated as soon as eligibility allows, we might not be able to enjoy this nice summer weather as we have been, and certainly this weekend was a wonderful weekend. Lastly, I want to remind everyone, as we do every week, that our hospital is safe and our emergency departments are open 24 hours a day, 7 days a week. Please do not delay care for medical emergencies. We are here to care for you and we have the capacity to do so. Thank you.
Thank you, Ms. Young-Ritchie. Thank you, Dr. Mackie. Thank you, Mayor Holder. We will get to the questions we'll get to the questions right now. How's that? And the first question, actually, Carol, is for you, and it comes to us from Jennifer Beeman at the London Free Press. Carol Young-Ritchie, what are LHSC's surgical volumes now that non-emergency surgeries are permitted by the province? How many weeks will it take for LHSC to ramp up?
Well, I'm not sure how many weeks it's actually going to take, but I can tell you we are continuing to look and to make our efforts to gradually resume some of our volumes in a measured approach that's safe and sustainable. As I said in my initial comments, we are starting to redeploy back and we're starting to increase our surgical activity. So for example, our operating rooms, today we're running 11 out of our 15 at University Hospital and 14 out of our 17 at Victoria Hospital and our surgical care center. So we're slowly responding as we have staff to redeploy back and want to make sure that we're balancing care for our COVID patients with some of the activity that we are able to do. So we're excited to be able to do that.
Thank you very much, Carol. Let's go to our next question. And that one is for Dr. Mackie. And it's from Jennifer Beeman at the Free Press again. Dr. Mackie, do you have a timeline when the London area will be able to open up second dose rebookings to people who received an mRNA shot on or before April 18th, aligning with other regions that have already done this?
Yeah, so thanks for the question, Jennifer. I know the provincial booking system started allowing that today, in part because we now have an additional strategic allotment of 3,000 doses. We're able to actually move that timeline up to Thursday so that as we reopen second dose rebookings to those who are 70 and older as of Thursday, we'll also be able to do that for anyone that got their mRNA shot on or before April 18th.
Thank you, Dr. Mackie. Next question comes to us again from Jennifer Beeman. It's a follow-up for you. Dr. Mackie, what should we make of the 3 new cases today? Is the extremely low count the result of a lag in weekend testing?
Yeah, the weekend is definitely a factor, and it's less about lag as it is about people choosing to do other things on the weekend. You know, the assessment centers have consistently from day one seen lower volumes of testing on the weekend, And that's primarily because, folks are doing fun things and not necessarily choosing to spend their time at an assessment center. So, and also we have seen volumes of in upwards of, 90, 100 cases on a Monday over the past few months as we went through wave 3. So it is definitely not entirely due to the low testing over the weekend.
Thank you very much. The next question comes to us from Jordan Reed at CTV London. And I do want to say at this point, if you are on the call and you are a member of the media and you've got a question that you've been thinking about asking, now would be the time to put it in. We do have a shorter than usual list of questions. So that would be your notice to submit your questions here on Microsoft Teams. Dr. Mackie, the next question is from Jordan Reed at CTV London. Dr. Mackie, stage 1 of reopening is running ahead of schedule. Are there any concerns for a fourth wave of COVID-19 as the region enters stage 1 ahead of schedule?
Well, as we kind of predicted last spring, COVID has proven to be a seasonal virus. And that's, predictable in part because there are many coronaviruses that circulate in Canada every winter, have been for decades, except in just much smaller numbers. And we see them circulating at the same time as influenza. The season for COVID is a bit more spread out. Influenza usually peaks February, give or take a month, COVID, and lasts for a total of about 8 to 12 weeks. Coronaviruses prior to COVID usually would have more like a 4 or 5 month season, anywhere from November till May, give or take, depending on the year. And so again, we expected this virus to be seasonal. We've definitely seen that. And if you look around the world, you've seen a similar pattern in most places. The same season that is the influenza season has generated a COVID season, and places have generally seen lower rates in their summer season. What that means is that while a fourth wave may be coming, we don't expect that to happen before the fall. I believe we will continue to see case counts that are relatively low over the summer, particularly with the vaccine campaign coming on top of the seasonality of the virus, but would not at all be surprised if we do see additional waves of COVID coming through, in a seasonal way, either fall or winter next year.
Thank you, Dr. Mackie. Let's go to the next question. It's a follow-up from Jennifer Beeman at the Free Press. Dr. Mackie, other than the added 3,000 doses this week, are our shipments of about 25 to 27,000 doses a week fairly consistent as we look at the weeks ahead?
Yeah, they're fairly consistent. And, the 3,000, the consistent number is the Pfizer numbers, 24, 25,000 each week. The really inconsistent number is the Moderna number. Some weeks we might have 5 or 10,000 allocated. The 3,000 additional doses this week are actually Moderna. So that's the one that tends to ebb and flow a lot more than Pfizer. There is, an overall decrease in Pfizer's allocation to Canada that comes in July, a small amount. So our total will go at that point from about 25,000 per week, Pfizer, to 24,000, something in that range. But we do expect Moderna to really pick up in the next couple of weeks. And so it should more than cover for what we're losing in Pfizer.
And a quick follow-up from Jen Beeman, Dr. Mackie. How did the 80-plus second dose rebookings work out this morning?
Yeah, thanks for the question, Jennifer. The 80-plus second dose rebookings worked about as well as expected, and we actually did expect significant hurdles. And that's because our system hasn't yet been able to parse out where one person used the same contact information to book more than one appointment. So maybe for a spouse or for a parent or for children or others in their family. We're still working on a technological solution to sort out which appointment needs to be canceled in order to rebook the other appointments. And that's we hope to have that solution in place. So if anyone had an appointment that was booked, just one appointment on one email address or one appointment on one cell phone as a preferred contact, then they would have received a unique link that they can use to rebook their one appointment. If they had more than one appointment booked per email or phone, then they weren't able to do that online. That pushes them to the phone system as the only option. As we know, on these opening days, the phone system is overwhelmed. So we're still working on a tech solution, hope to have it in place over the next week, but I anticipate that it won't necessarily be in place for Thursday. So we may see a lot of challenges then as well. This is something we knew about in advance. We did message out about it through the PSA, but of course, the reality when people are trying to get into the booking system and are frustrated with the phone waits or whatever it is, it sure can be a difficult experience for folks.
Thank you, Dr. Mackie. And what is right now our last question, pending any others coming in as you're answering this. This one comes from Carrie Mackie at CBC London. Dr. Mackie, are you concerned that with such a low case count, people will start letting down their guards and getting together with more people or tossing out their masks altogether?
I really hope that people aren't going to jump the gun. We see the reopening steps, step 1, 2, 3, as quite appropriate. That means right now, outdoor gathering of 5 only, no indoor gatherings. You start to see the outdoor gathering limit increase in step 1, which is just a week away. Let's see if we can make this through for the next week. Next week, also patios open, so that'll be a big positive change for our restaurateurs and those that enjoy that experience. So that's for the June 14th week. Let's very much hope that people can keeping their distance, continue keeping their distance, and follow those reopening guidelines. They will every few weeks we'll see more and more opportunities for gathering.